The World Tuberculosis Day, organized by the World Health Organization on March 24th each year, is focused to create public awareness, spread knowledge and awareness of tuberculosis, an infectious disease that kills millions every year. At the gathering of the World Tuberculosis Day 2023 held on Friday, the theme of the event, named "Yes, We Can End TB," was marked at accelerated action, multi-sectoral collaborations to combat the TB epidemic, adoption of innovations, faster uptake of new World Health Organization recommendations, amongst others. Dr. Laxmikant Chavan, the acting team leader and technical officer on behalf of Dr. Walter Kazadi Molombo, the World Health Organization country representative and head of mission to Nigeria, in the ministerial briefing disclosed that
while the world is struggling to really tackle this, Nigeria is busy doing innovation. Nigeria was busy doing accelerated action, and that's why in Nigeria 60% of cases during the same pandemic period, they were used to detect, and this is one of the great achievements I think the Nigerian TB team has done. So I think this is really outstanding, and they have done this during that critical period with really a lot of innovations, bringing the community on board, using the technology. So all those innovations and things they have really done well in Nigeria.
Speaking further, the board chairman, Stop Tuberculosis Partnership, Nigerian Program Coordinator, Dr. Queen Ogoji Ladipo, says TB disease is more severe in children with higher mortality amongst those less than 5 years of age, noting that the team is in their collective power to end tuberculosis by 2030.
As a partnership, we highly commend the government of Nigeria and all partners for your continuous support to end TB in Nigeria. By working together, we will be able to improve TB control in Nigeria. As you all know, out of the annual estimate of 479,000 TB cases in Nigeria in 2022, only 561 were notified. This is a good progress in the right direction, and considering the fact that Nigeria was able to increase its notification even when the world was grappling with COVID-19 and many countries of the world had very low case notification and more TB deaths. The increase has been consistent since then, and Nigeria needs to be applauded for this.
Mrs. Omoshalewa Oyelaron, Deputy Director, Health System Strengthening and Tuberculosis of the USAID, while briefing journalists, expressed that
to combat this debilitating disease, USAID collaborates with the government of Nigeria and other national and international partners to support the National Tuberculosis Program. Since 2023, USAID has contributed more than $250 million to the tuberculosis program. In partnership with the government of Nigeria, USAID's TB Accelerator model invested in local civil society organizations to increase access to quality TB prevention, diagnosis, treatment, including multiple drug-resistant TB. These local CSOs collaborate with the national and state TB programs to deploy scale and state-of-the-art equipment and tools to improve the detection of TB.
Also speaking, the Minister of State for Health, Honorable Ekumankama Joseph, said
TB is a major public health problem globally, likewise in Nigeria. According to the 2022 World Health Organization Global TB Report, Nigeria is ranked 6th globally and 1st in Africa with an estimated 467,000 TB cases in 2021. Nigeria ranks 5th in the world among countries with the highest burden of childhood TB. The country is equally one of the 10 countries in the world with a triple burden of TB, drug-resistant TB and HIV-associated TB. The main drivers of the TB burden in the country are undernutrition, HIV, diabetes mellitus, smoking and alcohol use, with working age group of 15 to 44 years mostly affected by TB and TB deaths. Furthermore, low awareness about TB is a major challenge as only one out of every 4 Nigerians has adequate knowledge of TB.
He added that a key challenge to the control efforts has been access to tuberculosis services.
The key challenge to our control efforts has been access to TB services. The TB service coverage for 2022 was 50%, as services were only available in 20,148 out of 40,562 health facilities in the country. Similarly, 372 out of 774 local government areas have at least a rapid molecular test for TB diagnosis, translating to 78% coverage. Furthermore, low child TB notification is also a challenging aspect of our TB response, as the country notified only 19% of the estimated 69,000 childhood TB cases in 2022.
Thereby advising that
this year's World TB Day theme is "Yes, we can end TB," and the slogan "Get involved" is apt. We must all get involved. This is a call to all well-meaning Nigerians at all levels to join hands with the government in the fight to end the TB scourge. A call to the development partners, the corporate bodies, not to rest on their oars, the press not to relent in disseminating appropriate messages on the infection. We all have a role to play.